They pay in California, it's called Medi-Cal in California, 7 to 12 cents on the dollar, even worse than here. What business can take 7 to 10 cents, 7 to 12 cents of their accounts receivable as actual pay and write off the rest and be there to do what they do to help people to everybody else? I submit to you, not one. Not one could. And in effect, that's what's being foisted in a greater or lesser degree by all of this, whether it's medical assistance, Medicare, or eventually Obamacare by 2014.
San Antonio, the national coordinator with Campus Liberty Alliance, sitting down with Dr. Jeffrey Glassheim, a local physician here in Neenah, Wisconsin, talking about Obamacare and how it affects you. Dr. Glassheim, talk about your background and your medical qualifications.
Well, I'm Jeff Glassheim. I'm a doctor of osteopathic medicine, a DO, which make up about 15 to 18% of physicians in America. It's a uniquely American degree, non-generic. There's now about 23 osteopathic medical schools in the United States out of about 125 schools total. So we're now about 1/5 of the schools. I took my general pediatric internship and pediatric residency in the mid-1980s. 1 year at a civilian hospital, 2 years at a military institution, and then went on for further training after a couple of years practicing as a pediatrician in allergy and clinical immunology to become a specialist in asthma and allergic disease medicine. All that was between the mid-80s and 1990, 1991. After that, I stayed in the Army Medical Corps until 1993, where I served a total of 13 years' time, 8.5 years on active duty. Went into private practice, first in a couple of groups and then in my own practice in Central California from the mid-90s to the mid-2000s, at which time I sold the practice and relocated my family to Wisconsin.
One of the keys I see in Obamacare and what affects us as individuals is the relationship between the doctor and the patient. Number one, talk about how Obamacare is affecting you as a doctor, as a working physician, and then number two, how it's affecting patients.
Well, the first question, it's driving me out of this practice. I mean, for me to stay in this practice, even at a long-term agreement that was offered to me of 39 months, I would have had to accept anywhere from a 25% to as little as an 8% once I whittled it down pay cut, but the lower pay cut was with increasing onerous provisions that made it even less palatable. So in effect, I was forced to say no thank you, and so that triggered them giving me the 90-day notice. That's a without cause termination, if you will. So the good news is I'll be a free agent. No non-compete provisions do I have to worry about. I could literally do whatever I want and whatever auspices I join up to. That will, I suspect, not very much be a unique story throughout the country. It's already happening in pockets. It's going to come up first in areas that corporate practices dominate. In terms of the patient, which is the bigger question, the patients aren't getting ownership of their diagnoses being taken by their healthcare physicians the way they have come to expect for decades, if not centuries. Instead, you have these codes and little pockets of corporate and computerized data that get put into a system of questionable confidentiality, even though it's probably gotten better. And you are reduced to a series of codes and numbers by the average employed physicians who populate these corporations, as opposed to an independent practitioner taking ownership of those diagnoses and of the responsibility between making those diagnoses and fully educating hands-on those patients about what they have and what need to do to manage their diagnoses and diseases. That's old-fashioned good quality care. Yes. That's being minimized, peripheralized, and marginalized more and more, sadly.
Obamacare was ran through Congress. Most members of Congress didn't even read the text, didn't have the opportunity to do so. Now that it is law, what do you see as the greatest threat that has reared its head out of this new law that's passed?
The biggest danger is going to be the actual, not just theoretic, but the actual rationing. First, it'll be to the weakest, frail, and aged of our population through the already in existence government-paid practice programs like Medicare and medical assistance programs. But as with everything else that's happened since the early 1980s, what starts there filters through the private health insurers who do more and more mimic what comes down from above, if you will, so that they themselves can also participate in some of those cost savings and increase their profits and increase the 7-figure CEO salaries to maybe 8-figure ones, as well as to the shareholders that own stock in those corporations.
Sure.
And that's what's happening for already quite a long time.
A lot of people were fooled into supporting Obamacare because the American Medical Association, the AMA, came on board and endorsed it. What are your thoughts on that?
Well, the AMA does not represent the interests of physicians, or at least not the overwhelming majority of physicians. I mean, there's over 2/3 to 3/4 of a million physicians in practice today, and a tiny percent that's barely in the low to mid-teens the last time I checked. I don't think it's top 20, 25%, and I don't know how long, are actual members. I myself have not been a member of the AMA since I was a few years out of medical school. I find, though, that most people who were in between and who wanted who ended up being in favor in terms of not a voting legislator, but a person in the population, were only in favor of it because they were in favor of not having the status quo. Well, I'm not either in favor of that, but that doesn't mean you jump to something that's going to make it worse. As long as you have a balance in cost and benefit that actually has a system be workable. And right now, it's clearly not going to be workable. The costs are already going up in anticipation of the actual costs going up. People, open enrollments are in the fall for the next calendar year, and they're already showing huge increases in a deflationary environment otherwise. It's not a high inflation time we're living in right now. And that's the facts of what's going on before we even get out of the chute.
We hear a lot about Obamacare affecting the elderly, but how does this affect young people in their future?
Well, they have more of their life to live under this. So that to me is the most onerous effect. People say that health care insurance is rampant. I take offense to that. Some of that is due to the technical advancements, sure. Very little of it is due to physicians' incomes. And a whole host of it is not even true. It's health insurance inflation, not health care inflation. And people aren't making that distinguishing factor very clear. And that's really the truth.
We know about the problems of Obamacare, but what are the solutions that you see, in particular free market medicine?
I really feel that there needs to be a critical mass of physicians that are willing to practice independently, either on their own or in small groups, where they're partners with each other, with small practices that can afford to pay out of their pocket. I'd even be willing in a practice like that to still send bills to private payers who are offering fair plans that were not HMOs and were not part of this morass that we're dealing with now with these government-paid entities, just to get some of these people some money back that goes directly to them. But I don't want to have relationships with them. I want to have only relationships with patients clinically as well as business-wise, like every other business gets to deal with their end-user client. That is not a bad thing, but you'd even be hard-pressed to go and do polling of office managers and front office receptionists who enjoy collecting money from their patients. They hate it. They just want the checks to come in the mail, because that's become the way it is. Okay? Well, that's not real. Those checks are not real. They're not real money. And they involve a lot of blood money in there because people are paying through the teeth for that, whether it's the users, the patients, or the receivers, the practices. That's just not real. It's better to ditch all that and either on an annualized retainer basis or a monthly payment basis or whatever you want to work out in your own particular little practice, you work it out direct with those people. Say, this is what it is. Post your fees. Just post them on the board, so as soon as you come in, you see it just like you do in a car shop. I'm not against that. This is what we charge for this. This is what we charge for this. This is the full price. No decreased or anything like that we do for these other companies. If I have to give discounts to multi-billion-dollar corporations whose CEOs make multiple $million a year, how come we don't get those discounts?
This is Sam Antonio with Campus Liberty Alliance. Come visit us on Facebook and also on Twitter at Campus Liberty Alliance, and on Twitter, Campus Liberty 1. Thank you for joining us.